Welcome to this free online course called Respectful and Culturally Appropriate Care. This course is made for medical receptionists and practice nurses working in general practice across Australia. The course takes less than an hour to complete. It is self-paced, online, and completely free. You will receive a certificate of completion if you pass the quiz at the end. The purpose of this training is simple. It helps you learn how to provide care that is respectful, inclusive, and culturally safe. You will learn how to understand cultural differences, communicate clearly with patients, and respond in the right way when people have different beliefs, backgrounds, or needs. You will also learn how to work respectfully with Aboriginal and Torres Strait Islander peoples, people from culturally and linguistically diverse backgrounds, people with disabilities, and others who may require a thoughtful and respectful approach. Patients feel safer and are more likely to participate in their care when they are treated with kindness and respect. This course will give you real examples and practical tips to help you do just that, especially at the front desk or during everyday interactions. It is important to know that this course also helps your practice meet its obligations under culturally safe practice requirements. It is a great addition to your personal CPD record and a useful training record for practices aiming for accreditation. To enroll, visit www.courses.generalpracticetraining.com.au and register. It is free and you will not be asked for any payment or credit card details. When you create your profile, please enter your name exactly how you would like it to appear on your certificate. Volunteers run this platform, and the ads on the site help cover the costs so the training can remain free for everyone. If you find the course useful, consider sharing it with your colleagues or supporting us by buying a coffee through the link on the website. Please remember, watching this video is not enough to receive a certificate. You need to complete the course at the website and pass the quiz at the end. Thank you for your time and commitment to respectful and culturally appropriate care. You are helping make healthcare safer and more inclusive for everyone. Course content: no discrimination. Every patient who walks into a general practice deserves to be treated with respect, fairness, and dignity. Discrimination has no place in a healthcare setting. This includes discrimination based on race, appearance, gender, religion, age, disability, or any other personal characteristic. Your personal views must not affect the way you interact with patients. Even if a patient's beliefs or lifestyle choices are different from yours, your responsibility is to provide the same high standard of care and courtesy. Making jokes about patients, even behind their backs, is not acceptable. Rolling your eyes or showing impatience when someone struggles to communicate is also inappropriate. Every patient deserves to feel safe and respected in the clinic. Culturally appropriate care: people from different cultural backgrounds may view health, illness, and medical treatment in different ways. Some patients may not be familiar with how Australian clinics work. Others may have expectations shaped by experiences in different countries or cultural traditions. This is why it is important to remain open-minded and avoid making assumptions. Ask questions if you are unsure. Offer explanations if a patient seems confused. Take time to listen and be patient. When possible, consider the patient's cultural needs when arranging appointments or procedures. For example, some cultures prefer same-gender healthcare providers or may need extra time to understand certain instructions. Being culturally aware helps patients feel valued and more willing to engage in their care. Patients' responsibility: respect goes both ways. Just as patients deserve to be treated respectfully, staff members also have the right to a safe and respectful workplace. If a patient becomes aggressive, abusive, or repeatedly crosses professional boundaries, they may be asked to leave or may need to be managed under the clinic's behavioral policy. It is okay to calmly explain that certain behaviors are not acceptable. For example, you can say, "I'm here to help, but I need you to speak to me respectfully." Clear boundaries protect both staff and patients and help maintain a safe, professional environment. Respecting patients' choices. Patients have the right to make decisions about their care. That includes the right to choose the healthcare provider when possible, the right to request a male or female doctor or nurse, and the right to refuse treatment or tests based on personal or cultural beliefs. Even if you don't agree with a patient's decision, it is important to respect it. If the request cannot be met, explain it clearly and calmly. For example, you might say, "Unfortunately, we only have male doctors available today, but I can help you book for another day when a female doctor is here." Respecting patient choices helps build trust and improves the care experience. Thank you for taking part in this course. By learning how to provide respectful and culturally appropriate care, you are helping your practice offer a safer and more inclusive experience for all patients. Now that you have completed the training, please go to the quiz page. You will need to score at least 50% to receive your certificate. Good luck, and thank you for helping create a better healthcare experience for everyone.